So we have the summit underway in Washington, D.C., missing from the summit because they don't want to have a conflict of interest, are Pfizer and Moderna, because one of the FDA regulators who has to approve the emergency use authorization is at the summit. What do you hope comes out of this summit, Doctor?
To be honest, I'm not really sure what the point of the summit is. We have some really great information that we got today on the Pfizer briefing report. It seems to, correspond with what we heard from before about Pfizer details on the study. And so I think what we should do is just think about just moving forward with this glimmer of hope that we have, and hope that we have enough vaccines to really vaccinate a good proportion of the healthcare workers and residents of long-term healthcare facilities that are waiting for the vaccine.
Hey, Dr. Blackstock, it's Sean. I just want to clarify this for our viewers, because from my understanding, the vaccine will most likely keep you from getting sick, but we don't know whether or not it will prevent you, I guess, from transmitting the virus to somebody else. So what does that mean just in terms of the future of the mask mandate? Should we continue to wear a mask even if you are vaccinated? And when can we expect to get a little bit more clarity on this issue?
Right. So we know that the vaccine reduces the severity of disease, but we don't know whether or not it prevents transmission of infection. And that's why the vaccine and its results need to be studied for a longer period of time. But what that means also is that we're not going to be saying goodbye to our masks anytime soon. We'll likely still be wearing masks into the end of 2021 until we have more data on how, whether or not individuals are still infectious if they've received the vaccine. And so that's really important information that we need moving forward.
Dr. Blackstock, Anjali here. I know that in our conversations, of course, health equity is a really big issue, and the pandemic has really highlighted that for the U.S. I wonder, do you have any thoughts on President-elect Joe Biden's picks, especially for Javier Becerra for HHS, leading that in the middle of the pandemic, and what that could mean for the response going forward?
Sure. I think that, what we've seen actually regarding, equity in the pandemic is that, Black and Latinx communities have really suffered not only disproportionate health impacts from the virus, but also significant job losses, small business closures. And we know that employer-sponsored health insurance has also been lost. And so Becerra has been someone who has advocated for the ACA, as well as expansions associated with the ACA. And we really need to have folks in that cabinet that understand the importance of every American being uninsured, because what we're seeing right now and what's contributing to that is, also rates of uninsurance and underinsurance and folks not being able to appropriately protect themselves.
Doctor, when we talk about this vaccine and the number of doses everyone's going to need, we also hear people say that most Americans will have access to the vaccine by this summer. You're on the ground floor of the people who are going to have to administer this to us. Is that realistic that all of us could potentially have access and get the vaccine by, say, June or July?
I think that is an optimistic timeline. There's several barriers that we will have to face. One, obviously, the logistics of hospitals and pharmacies distributing the vaccine, but also we know that there are cold chain storage issues, and not all mom and pop pharmacies have those. But also there's also the issue of accessibility. We know that hospitals and pharmacies are not necessarily in every neighborhood, and that we need to, perhaps have mobile vaccine testing sites. And then finally, we have high rates of vaccine hesitancy in the U.S. population, particularly among communities of color. So we're also going to need an expansive public health campaign, outreach and messaging to counteract some of the misconceptions and misunderstandings about the vaccine. So all that plus, we know that there are some limitations in terms of vaccine manufacturing capabilities. I don't think that a vaccine or everyone will be vaccinated by June. I think we're probably looking more towards the end of 2021.
Doctor, when we talk about the hospitals, or many more hospitals reaching max capacity right now, and we talk about vaccinating the elderly, the at-risk patients, many of those do end up in the hospital. Is it not going to be until these people are vaccinated that hospitals will start to see any sort of relief or any sort of breathing room?
Yeah, that's a great question. At this point, we're just seeing such widespread transmission of the virus. Yes, a good number of those people are elderly people, but we're also seeing a lot of younger patients with multiple chronic underlying medical problems, which often can cause someone to get very sick and hospitalized due to coronavirus. So I think we're going to need to take as widespread approach as possible. Obviously, the elderly should be prioritized, but so should essential workers and service workers who have public facing jobs as well.
Anjali, I think you had one last question for Dr. Uche Blackstock.
I did, thank you. Dr. Blackstock, sorry, I forgot to unmute there. Looking at to the question about the timeline, I know that there have been a lot of predictions that we'll start to get the vaccinations by March and April for the general population. Where do you stand on this issue of potentially a shortfall of potential vaccines, knowing that we only know for sure Moderna right now and a question mark on others like Novavax and Johnson & Johnson?
Yeah, no, I think that I am cautiously optimistic. I think that we may run into shortage issues into the late winter, early spring, and so that's why I do believe that this vaccine rollout is going to take much longer than anticipated, and so we should have cautious expectations about what's going to happen over the next few months.